episode of MPH Swasthevani, Season 2, Episode 3. I am Dr. Surbi Chaudhary, dentist by profession, currently pursuing MPH-PHN. Coming from a clinical background, I realize that healthcare is not just about treatment, but also about prevention, policies, and community intervention. And that's what exactly public health focuses on. MPH, we all have heard about it, right? But MPH in public health nutrition, what exactly is it? Honestly, I had the same question when I entered the field, but as I explore, I find it more fascinating and impactful. And just like each one of you, I want to know more. And who's better to give it the real picture than someone who has been there, done that? So we have a special guest today, an expert in public health nutrition, who's going to share insights, experiences, and what's exactly in the field beyond the textbook. Welcome, Dr. Shalu Chaudhary, who's an assistant professor at Indian Institute of Public Health, Gandhinagar, an MBBS, MD Community Medicine, PhD scholar, public health nutrition expert. She has significantly contributed to health policy and planning in Gujarat and UNICEF and SHSRC. She has served as a district program officer for non-communicable diseases and epidemic intelligence officer for COVID-19, receiving award for her dedication to serving remote communities, a researcher, trainer, and an artist. She blends academia with creativity. She's a classical flute and harmonium player and a mixed media artist as well. At IIPFG, she teaches demography, PHN, and is undertaking research on anemia, sickle cell disease, and malnutrition. Apart from leading IVA, our institute recently launched this new course. What was the vision behind it? Is it to expand the MPH course, or what is it exactly?
So coming to this question, the Indian Institute of Public Health, Gandhinagar, has placed itself in the field of public health nutrition with a huge array of work. The institute is closely working with the Department of Women and Child Development, Education Department and Health Department, and has a Center of Excellence for Nutrition going on in this campus, and also functioning at the different districts and ground level of Gujarat. So with this experience, we knew that the Center of Excellence Nutrition trains the field level functionaries, the Anganwadi workers, Mukhya Sevikas and supervisors. So we are into training the frontline functionaries. We also have PhD with many students enrolled here doing PhD in public health nutrition. Now the gap was in the middle section where experts in public health nutrition would bridge the gap between academia and the frontline functioning was missing. So that is where the vision of developing this course came into picture.
So the key idea was to empower the frontline functionaries.
Not just empower frontline functionaries, but to create a pool of experts who would go beyond just frontline functioning or beyond academia and strengthen the implementation of policy and bringing policies to programs.
I suppose that's very important these days. So we are going to have two segments precisely. So we are going with segment 1. So the question that come in my mind is, the first one is, what exactly is public health nutrition and how does it differ from MPH? Is it a subset or a different subject altogether?
Alright, so coming to this question, this is very pertinent. So public health nutrition is a field or a domain of public health where we apply principles of public health with the principles of nutrition in order to improve the health and overall well-being of the population. So looking at this definition, it is not something which is different from public health. हम generally भी ऐसा बोलते हैं कि public health is everything under the sun, including the sun. And if we look at nutrition, it is something which probably determines the all of the public health or the health related states or events. If we look at non-communicable diseases, communicable diseases, or the problems prevailing for maternal and child health, everything has a nutrition related problem underlying. So it is not different from public health, but rather a specialized track of public health.
Thank you, ma'am. And as all of us, what are the basic requirements to enroll in a public health nutrition program? Is MPH in public health nutrition a popular course abroad? Because as we all know, we all like to go abroad, and we all want to explore the opportunities that goes abroad. So that will be the question.
Yes. So coming to your first question, there is no separate requirement. What is the basic requirement for pursuing public health? Masters in public health, that is the same required for pursuing masters in public health for public health nutrition. Now coming to your second question, that whether public health nutrition is a sought after domain, then I would like to quote a research which was published in 2017 in WHO Bulletin. It says that to tackle the nutrition related issues, we need a huge workforce, especially so there's a workforce pyramid which states that for nutrition we have many frontline functionaries and we have specialized academicians who are pursuing research, but the mid-level functionaries who create a bridge between the evidence and the interventions. So functionaries who manage and implement public health program and are advocates of public health nutrition, that entire pool is missing, and those are the need of the future. Looking at that, it is perceived globally, and of course if you look at India, public health nutrition related challenges are a huge problem which the country is grappling to fight with. So that is, looking at this, yes, so public health nutrition and experts are the need.
Thank you, ma'am, for that. Can you share a couple of examples where public health nutrition interventions have made a significant impact in India?
So, coming to my personal experience, I have been researching anemia and its determinants. And the story so far we have heard is that iron folic acid is the predominant intervention which we do to prevent as well as treat anemia related issues. But from what I have researched and several evidence which we have gathered, we see that anemia is not just iron deficiency, and there are other factors involved, including multiple micronutrient deficiencies. And one of the startling finding for me was elevated HbA1c. So if you are metabolically unhealthy, probably you are also anemic. So it points that nutrition is something which is very not an easy problem to solve, but it is a complex enigma.
Surely. Before we move on to the next segment, let's take a quick break and have some fun with an icebreaker.
Sure.
Let's start with a warm-up question first. What's your favorite cuisine?
My favorite cuisine, there's no favorite cuisine, but
Tell me some or one.
I like to eat Chinese. And I like what my mother cooks.
Oh.
It's a cliche answer, but that is what I love.
तो आपका comfort food वही है जो आप
Is whatever my mother cooks.
Okay. What's your favorite eatery?
Okay, so I don't have a particular favorite eatery. If you look at the twin city of Ahmedabad and Gandhinagar, here every new cafe or new restaurant will open up. So what I like to do with my friends is explore whatever new cafes.
In Chinese?
Opening. Not just Chinese, anything. So not particularly related to one cuisine, but anything which opens up and we want to explore.
I have recently tried sushi, vegetarian sushi. I don't know how people look at that, but yeah, I've tried that. तो ये तो बस warm up था. We have short segment for you, which we call Would You Rather Nutrition Edition. I'll give you two options, and you have to pick one. No overthinking, just go with your gut.
Okay, rapid fire.
Ready. Ready? Here we go. Would you rather eat only fruits or only vegetables for a month?
Well, it's no brainer, only vegetables. Because fruits, I have also taught in my class that it leads to fructose overload and will fry up your liver. So, yes, only vegetables.
Okay. Would you rather use your imaginary superpower for eradicating childhood malnutrition or adult obesity?
Again, childhood malnutrition, because fetal programming hypothesis, which states that undernutrition leads to overnutrition.
And vicious cycle को break करना better है. Would you rather design a national nutrition policy or lead a grassroots nutrition program?
So, as we discussed with the success story of iodine deficiency control program, a good policy always has a beginning or a root at the grassroots level. So, yes, grassroots.
Oh, that was something. Some of the choices were tough because I would have taken fruits. And hey, to no take backs, now let's move on from fun hypotheticals to real world action. Because nutrition isn't just about would you rather moments, and it's also about making impact. So buckle up, the next segment is coming your way. Ma'am, can you share a couple of examples where public health nutrition interventions have made significant impact in India?
Yes, so if you look at India, there's a success story I would like to point towards. So if you look at the National Iodine Deficiency Disorder Control Program, the evolution of the program itself is a huge success story and tells you how public health nutrition plays a vital role in improving the nutritional and health status of the population. This started by applying the principles of public health and epidemiology. So this began in Kangra district in Himachal Pradesh, where there was huge prevalence of goiter, and then there was a hypothesis that iodine deficiency is something which is causing goiter, and this cause and effect was established, and then the intervention which was thought to tackle this was that salt, which is commonly used, can be used as the vehicle for fortification with iodine, which can then subsequently prevent goiter among the population, which was a huge success. And then from there, if we look the journey which we have traveled, currently salt fortification is something which is done blanket in the country. Non-iodized salt is banned, and the prevalence of iodine deficiency related disorders and the morbidity and mortality associated with it is negligible in the population. So it is a success story which is also inspiring how public health nutritionists can work in this domain.
Truly, truly. You have worked in the field, and definitely, what have been the biggest nutrition related challenges that public health professionals are facing today? Have you personally encountered any particularly tough situation in your work, and how did you handle them? कोई भी ऐसा केस या experience you can share?
Rather than public health professionals facing a challenge, I would say that overall the community, the nation, or even globally, we face lot of challenges which has nutrition in the background. And when we arrive at this point, I feel that the problem becomes very complex, requiring intersectoral collaboration and sort of a package which has multiple interventions which would address nutrition related issues. So if I come to my personal experience, I have been researching anemia and its determinants. Till now, if you look at Anemia Mukt Bharat program, we see that the major intervention which is done is giving iron folic acid to prevent as well as treat anemia.
For someone who is actually interested in pursuing MPH in public health nutrition, आपका advice क्या होगा उसको?
मेरा एडवाइस होगा कि ज़्यादा सोचे नहीं और एक इन्फॉर्म डिसीजन ले, and they can definitely pursue the course because the field is of public health nutrition.
And the field is welcoming indeed. And last but not the least, for sharing your expertise. And so, how do you like our podcast today?
I really enjoyed recording this podcast, and for me, more enjoying was the behind the scenes of the actual podcast. And as much as I look forward to the podcast, I also look forward to the bloopers episode.
And now my personal one question that मैं मक्खन नहीं लगा रही, but what is the secret sauce of your fitness?
Fitness.
So this is a very demanding question because so I need to ask that.
Okay, I don't know about fitness because recently I faced an injury and I could not pursue all those activities which I used to do. But then, okay, partly I would give credits to my genetics.
So thank you, ma'am, for joining us and sharing such valuable insights. And to all our listeners, keep learning, keep questioning, and remember, good health starts with right knowledge. Don't forget to follow our podcast, share this episode, and stay tuned for the next exciting podcast and discussions in IFPHG Swasthavani Season 2. Until next time, stay healthy and stay aware.